Question 1. The review process indicates that a commercial driver has tested positive for a controlled substance, triggering the DOT return to duty process. As the substance abuse professional SAP assigned to this case, which prevention approach is most directly mandated and appropriate for guiding the employee's required education and / or treatment plan to facilitate a safe return to safety-sensitive duties? Option A. Universal prevention, which is applied to the entire population without regard to individual risk factors. Option B. Tertiary prevention, focusing on rehabilitation and relapse prevention for individuals who have already experienced negative consequences from substance use. Option C. Secondary prevention, targeting individuals showing early signs of substance abuse to prevent progression to more severe problems. Option D. Primary prevention, aimed at preventing the initial onset of substance abuse in the general population or at-risk groups. The correct answer is B. Tertiary prevention, focusing on rehabilitation and relapse prevention for individuals who have already experienced negative consequences from substance use. Explanation. This scenario presents a professional challenge because a substance abuse professional SAP must accurately identify and apply the most appropriate prevention strategy based on the specific context of an employee's return-to-duty process, adhering strictly to the U.S. Department of Transportation regulations. The SAP's role is critical in ensuring public safety by facilitating a safe return to duty for employees who have violated drug and alcohol testing regulations. Misidentifying the prevention approach can lead to ineffective interventions, potentially compromising safety, and failing to meet regulatory requirements. The correct approach represents best professional practice because it directly aligns with the SAP's mandated role in the DOT return-to-duty process. The primary goal of the SAP evaluation is to assess the employee's specific situation, determine the nature of the violation, and recommend a course of education and / or treatment. Tertiary prevention, which focuses on rehabilitation and preventing relapse after a violation has occurred, is the most relevant and required approach in this context. The DOT regulations, 49 CFR Part 40, mandate that a SAP must recommend a program of education and / or treatment for an employee who has violated a DOT drug or alcohol testing regulation. This recommendation is a crucial step in the return-to-duty process, aiming to address the underlying issues that led to the violation and ensure the employee's fitness for duty. An incorrect approach that focuses solely on primary prevention would be a regulatory and ethical failure. Primary prevention aims to prevent the initial occurrence of substance abuse in the general population or specific at-risk groups. Applying this to an employee who has already violated DOT regulations is inappropriate because the violation signifies that the individual has already engaged in prohibited conduct. It fails to address the immediate need for intervention and rehabilitation required by the DOT regulations. An incorrect approach that focuses solely on secondary prevention would also be a regulatory and ethical failure. Secondary prevention targets individuals who are beginning to show signs of substance abuse but have not yet experienced significant consequences or violations. While an employee might be exhibiting early signs, the fact that a violation has occurred necessitates a more intensive intervention than typically associated with secondary prevention. The DOT regulations require a SAP to assess the severity of the violation and recommend a treatment plan accordingly, which often extends beyond early intervention. The professional decision-making process for similar situations should involve a thorough review of the employee's violation, the SAP's assessment of the employee's condition, and a comprehensive understanding of the DOT's 49 CFR Part 40 regulations. The SAP must first determine if a violation has occurred that triggers the return-to-duty process. If so, the SAP's primary responsibility is to conduct a comprehensive evaluation to determine the appropriate level of education and / or treatment. This evaluation should consider the nature of the violation, the employee's history, and any other relevant factors. The SAP must then recommend a specific program of education and / or treatment that is designed to address the employee's substance abuse issues and facilitate a safe return to safety-sensitive duties. This recommendation is not a general prevention strategy, but a specific, individualized plan mandated by the regulations. Question 2. The analysis reveals that a DOT-regulated employee has tested positive for a prohibited substance. The employer has provided the substance abuse professional, SAP, with a positive test result and a brief summary of the circumstances leading to the test, suggesting the employee is likely to be dishonest during the evaluation. The SAP is tasked with conducting the mandatory SAP evaluation. Which of the following approaches best aligns with the regulatory framework for SAP qualifications and duties? Option A. Conduct a face-to-face interview with the employee, review all provided documentation, and utilize a standardized assessment process to gather information and determine the employee's eligibility for return to duty, while remaining objective and allowing the employee to present their perspective. Option B. Immediately recommend a lengthy and intensive treatment program based on the employer's suspicion of dishonesty, without conducting a full assessment or allowing the employee to provide their account of the situation. Option C. Rely primarily on the employer's summary and the positive test result to determine the employee's treatment needs and recommend a specific rehabilitation program without conducting a direct interview with the employee. Option D. Inform the employee that due to the employer's report of likely dishonesty, the evaluation will be limited to confirming the employer's suspicions, and the employee's input will not be considered a significant factor in the assessment. The correct answer is A. Conduct a face-to-face interview with the employee, review all provided documentation, and utilize a standardized assessment process to gather information and determine the employee's eligibility for return to duty, while remaining objective and allowing the employee to present their perspective. Explanation. This scenario presents a common challenge for substance abuse professionals, SAP, in the United States, specifically under the Department of Transportation Regulations, 49 CFR Part 40. The core difficulty lies in balancing the need for a comprehensive assessment with the regulatory mandate to conduct a face-to-face interview and collect specific information. The SAP must avoid making premature judgments or relying solely on external information, which could compromise the integrity of the evaluation and the subsequent recommendations. The correct approach represents best professional practice because it adheres strictly to the DOT's 49 CFR Part 40 requirements for SAP evaluations. This regulation mandates a face-to-face interview, a review of all relevant information, and the use of a standardized assessment process to determine the employee's eligibility for return to duty. The SAP's role is to conduct an objective evaluation, not to act as an enforcer or investigator. By conducting the required interview and gathering all necessary documentation, the SAP ensures a thorough and compliant assessment, which is the foundation for appropriate recommendations. An incorrect approach that relies solely on the employer's report without conducting the mandatory face-to-face interview fails to meet the regulatory requirements of 49 CFR Part 40. This is a significant ethical and regulatory failure because the SAP is legally obligated to perform a direct evaluation of the employee. Another incorrect approach, such as immediately recommending a specific treatment program based on the initial report without a comprehensive assessment, bypasses the crucial evaluation phase and could lead to inappropriate or ineffective recommendations, violating the SAP's duty to provide a personalized and evidence-based plan. Finally, an approach that dismisses the employee's input or perspective during the interview, focusing only on confirming the employer's suspicions, compromises the objectivity and fairness of the assessment, which is a core ethical principle for SAPs. Professionals should employ a decision-making framework that prioritizes regulatory compliance and ethical conduct. This involves a systematic approach. First, understanding the specific regulatory requirements, in this case, 49 CFR Part 40. Second, conducting a thorough and objective assessment that includes all mandated components, such as the face-to-face interview. Third, gathering and reviewing all relevant documentation. And fourth, developing recommendations based on the comprehensive evaluation, ensuring they are appropriate, individualized, and compliant with regulations. Question 3. The performance metrics show a consistent pattern of employers requesting detailed updates on employees undergoing the SAP process, particularly those in safety-sensitive positions. A specific employer has contacted you, the SAP, requesting confirmation that an employee has completed all required components of the SAP evaluation and is cleared to return to duty. The employee has not yet provided explicit written authorization for you to release this specific information to the employer. What is the most appropriate course of action for the SAP in this situation? Option A. Disclose to the employer that the employee is participating in the SAP program, as this is standard procedure for safety-sensitive positions. Option B. Obtain explicit, written consent from the employee that specifically authorizes the disclosure of their completion status to the employer. Option C. Inform the employer that you cannot provide any information due to the employee's participation in the SAP program, as all information is confidential. Option D. Provide the employer with a general overview of the employee's progress in the SAP program, confirming their engagement without detailing specific outcomes. Correct answer is B. Obtain explicit, written consent from the employee that specifically authorizes the disclosure of their completion status to the employer. Explanation. Scenario analysis. This scenario presents a common yet complex challenge for substance abuse professionals, SAP, operating within the U.S. regulatory framework. The core difficulty lies in balancing the legal obligations to protect patient privacy under HIPAA and 42 CFR Part 2, with the need to provide accurate and timely information to an employer for safety-sensitive employment decisions. The employer's request, while seemingly straightforward, touches upon highly sensitive protected health information, FI, and requires careful navigation of consent requirements and disclosure limitations. Misinterpreting these regulations can lead to severe legal penalties, ethical breaches, and damage to the patient's trust and the SAP's professional standing. Correct approach analysis. The correct approach involves obtaining explicit, written consent from the employee that specifically authorizes the SAP to release the requested information to the employer. This consent must be informed, meaning the employee understands what information will be disclosed, to whom, for what purpose, and the potential consequences. This aligns directly with the core principles of HIPAA and 42 CFR Part 2, which mandate patient consent for the disclosure of PHI and substance use disorder, SUD, records, respectively. By adhering to the consent requirements, the SAP ensures patient privacy is protected while fulfilling the employer's legitimate need for information related to the employee's fitness for duty, as often required by DOT regulations for safety-sensitive positions. This approach upholds the ethical duty of confidentiality and the legal mandates of both HIPAA and 42 CFR Part 2. Correct approach is analysis. Disclosing any information without obtaining specific, written consent from the employee is a direct violation of HIPAA and 42 CFR Part 2. These regulations strictly prohibit the unauthorized disclosure of PHI and SUD records. Even if the employer is requesting information related to a workplace incident or a DOT-regulated position, the SAP cannot unilaterally decide to release information. This failure to obtain consent constitutes a significant privacy breach and can result in substantial fines and legal repercussions. Providing a general overview of the employee's participation in the SAP program without specific authorization, even if it confirms attendance, is also problematic. While 42 CFR Part 2 allows for limited disclosures for medical emergencies or research under specific circumstances, it does not permit general updates to employers without consent. This approach risks disclosing more information than is authorized or failing to meet the employer's specific needs, while still violating privacy regulations. Assuming the employer has an implied right to information because the employee is in a safety-sensitive position is a dangerous misinterpretation of the law. While employers have a right to ensure the safety of their workforce, this right does not supersede the explicit privacy protections afforded to individuals under HIPAA and 42 CFR Part 2. The legal framework requires a clear, documented process for information sharing, which begins with informed consent. Professional reasoning. When faced with an employer request for information about an employee undergoing SAP services, a SAP must first and foremost prioritize patient privacy and legal compliance. The decision-making process should involve 1. Identifying the nature of the request and the requesting party. 2. Consulting the relevant regulations, HIPAA, 42 CFR Part 2, and any applicable DOT regulations. 3. Determining if the request falls under any exceptions to the consent rule, which are very limited for employer requests. 4. If no exception applies, the SAP must explain to the employee the employer's request and the information that can be shared. 5. The SAP must then obtain a clear, written, and informed consent from the employee that specifically authorizes the disclosure of the requested information to the employer for the stated purpose. 6. Only after obtaining valid consent should the SAP proceed with the disclosure, ensuring that only the authorized information is shared. 7. If consent cannot be obtained, the SAP must inform the employer that, due to privacy regulations, specific information cannot be disclosed without the employee's authorization. Question 4. Quality control measures reveal that a substance abuse professional SAP has completed an evaluation for an employee who has tested positive for a prohibited substance. The employee's evaluation indicates a diagnosed anxiety disorder alongside their substance use disorder. The SAP's recommended plan includes substance abuse counseling, but does not explicitly address the anxiety disorder or recommend referral to a mental health professional for its management. Which of the following represents the most appropriate and compliant course of action for the SAP in this situation? Option A. Proceed with the return-to-duty process based solely on the completion of substance abuse counseling, as the primary focus of the SAP's role is substance abuse. Option B. Recommend a comprehensive treatment plan that addresses both the substance use disorder and the co-occurring anxiety disorder, potentially involving collaboration with a mental health professional, and document this integrated approach in the return-to-duty report. Option C. Recommend a higher level of substance abuse treatment without acknowledging or addressing the co-occurring anxiety disorder, assuming it will resolve with abstinence. Option D. Advise the employee to seek separate treatment for their anxiety disorder independently of the SAP process, and focus only on the substance abuse recommendations. The correct answer is B. Recommend a comprehensive treatment plan that addresses both the substance use disorder and the co-occurring anxiety disorder, potentially involving collaboration with a mental health professional, and document this integrated approach in the return-to-duty report. Explanation: this scenario is professionally challenging because it requires a substance abuse professional SAP to navigate the complex interplay between substance use disorders and co-occurring mental health conditions, all within the strict confines of U.S. Department of Transportation regulations. The SAP's primary responsibility is to determine if an employee has successfully completed the SAP's evaluation, treatment, and follow-up testing plan, and is therefore eligible to return to safety-sensitive duty. When co-occurring disorders are present, the SAP must ensure that the treatment plan addresses both the substance abuse and the mental health condition, as untreated mental health issues can significantly impede recovery from substance abuse and pose a safety risk. The correct approach involves a comprehensive assessment that identifies and addresses both the substance use disorder and any co-occurring mental health condition. This aligns with DOT 49 CFR Part 40 regulations, which mandate that the SAP conduct a thorough evaluation and recommend appropriate education and/or treatment. Best professional practice dictates that the SAP collaborate with mental health professionals when necessary to ensure integrated care. This collaborative approach ensures that the employee receives holistic treatment, increasing the likelihood of successful rehabilitation and a safe return to duty. The SAP's final report must clearly document the co-occurring disorders and the treatment plan for both, demonstrating compliance with the spirit and letter of the regulations. An incorrect approach would be to focus solely on the substance abuse disorder and disregard, or inadequately address the co-occurring mental health condition. This failure to conduct a comprehensive evaluation and recommend appropriate treatment for all identified conditions violates DOT 49 CFR Part 40. Specifically, it fails to meet the requirement for a thorough evaluation and the recommendation of appropriate education and/or treatment. Ethically, it is also a failure to provide the best possible care for the employee, potentially leading to relapse or continued safety risks. Another incorrect approach would be to delegate the entire mental health treatment to another professional without adequate oversight or integration into the overall SAP plan. While collaboration is encouraged, the SAP remains ultimately responsible for the employee's return-to-duty process and must ensure the mental health treatment is compatible with and supportive of the substance abuse recovery plan. This oversight failure also contravenes the comprehensive nature of the SAP's role. Professional decision-making process for similar situations should begin with a thorough understanding of DOT 49 CFR Part 40, particularly sections pertaining to the SAP's evaluation and treatment recommendation responsibilities. When co-occurring disorders are suspected or identified, the SAP must prioritize a comprehensive assessment that includes screening for mental health conditions. If a mental health condition is identified, the SAP should determine if they have the expertise to address it or if consultation/collaboration with a qualified mental health professional is necessary. The treatment plan must be integrated, addressing both conditions concurrently and ensuring that progress in one area supports progress in the other. The SAP must maintain clear documentation of all assessments, consultations, and treatment recommendations, ensuring transparency and compliance with regulatory requirements. Question 5. During the evaluation of an employee referred for a substance abuse professional SAP assessment following a workplace incident, which combination of assessment methods best ensures a comprehensive and compliant evaluation? Option A. A detailed clinical interview supplemented by validated self-report questionnaires addressing substance use history, consequences, and mental health symptoms. Option B. A series of standardized self-report questionnaires administered without any direct interaction with the employee. Option C. A brief clinical interview focusing only on the specific incident, without the use of any formal assessment instruments. Option D. A review of the employee's personnel file and a single, brief clinical interview. The correct answer is A. A detailed clinical interview supplemented by validated self-report questionnaires addressing substance use history, consequences, and mental health symptoms. Explanation. This scenario presents a professional challenge because a substance abuse professional, SAP, must gather comprehensive information to accurately assess an individual's substance abuse issues and their impact on their safety-sensitive job functions, as mandated by regulation. Challenge lies in selecting and integrating assessment methods that are both clinically sound and compliant with regulatory requirements, ensuring the assessment is thorough and unbiased. The correct approach represents best professional practice because it utilizes a multimodal assessment strategy. A clinical interview allows for direct interaction, rapport building, and exploration of the individual's history, current situation, and perceived impact of substance use. This is complemented by validated self-report questionnaires, which provide standardized data on substance use patterns, consequences, and potential co-occurring mental health issues. This combination offers a more robust and reliable picture than relying on a single method, aligning with the regulatory expectation for a comprehensive evaluation that informs the SAP's professional opinion and recommendations. An incorrect approach that relies solely on a clinical interview without any standardized instruments fails to meet the regulatory standard for a comprehensive assessment. While interviews are crucial, they can be subject to interviewer bias and may not systematically capture all relevant information. The absence of validated self-report measures means a significant portion of objective data is missed, potentially leading to an incomplete or inaccurate assessment. Another incorrect approach that uses only self-report questionnaires without a clinical interview is also professionally unacceptable. While questionnaires provide valuable data, they cannot replace the nuanced understanding gained from a direct interview. The SAP cannot probe for clarification, assess nonverbal cues, or build the necessary rapport to fully understand the individual's situation. This approach risks misinterpreting responses or overlooking critical contextual factors, violating the spirit and letter of comprehensive assessment requirements. The professional decision-making process for similar situations should involve a systematic approach. First, understanding the specific regulatory requirements for the SAP evaluation, including expectations for comprehensiveness. Second, identifying clinically validated assessment tools that are appropriate for the suspected substance use issues. Third, integrating these tools into a structured evaluation process that includes both direct interaction and standardized data collection. Finally, critically analyzing the gathered information from all sources to form a professional opinion and develop appropriate recommendations, always prioritizing the safety-sensitive nature of the individual's employment. Question 6. The assessment process reveals that a client referred for SAP evaluation due to a DOT violation also presents with significant symptoms of generalized anxiety disorder and moderate depression, which appear to predate their substance use. The SAP is considering recommending a course of cognitive behavioral therapy, CBT, focused on relapse prevention for substance abuse. Which of the following represents the most appropriate and ethically sound approach for the SAP? Option A. Proceed with a standard CBT program for substance abuse relapse prevention, assuming that addressing the substance use will naturally alleviate the anxiety and depression symptoms. Option B. Recommend a course of CBT for substance abuse, but advise the client that their co-occurring mental health conditions may limit the effectiveness of the treatment. Option C. Recommend that the client focus solely on abstinence from substances and postpone any mental health treatment until they have achieved a significant period of sobriety. Option D. Recommend a treatment plan that integrates CBT for substance abuse with concurrent treatment for the co-occurring anxiety and depression, potentially involving referral to a mental health professional for medication management or psychotherapy specific to those conditions. The correct answer is D. Recommend a treatment plan that integrates CBT for substance abuse with concurrent treatment for the co-occurring anxiety and depression, potentially involving referral to a mental health professional for medication management or psychotherapy specific to those conditions. Explanation: the assessment process reveals a common challenge for substance abuse professionals, SAP, when a client presents with co-occurring mental health conditions alongside their substance use disorder. The core of this challenge lies in determining the most effective and ethically sound approach to treatment planning, particularly when cognitive behavioral therapy, CBT, is being considered. CBT is a widely recognized and evidence-based modality for substance abuse, but its efficacy can be significantly impacted by untreated or inadequately addressed mental health issues. SAP must navigate the complexities of integrating these two treatment domains to ensure comprehensive care that addresses the root causes of the client's struggles and promotes sustained recovery. This requires careful consideration of the client's overall clinical picture, not just their substance use. The correct approach involves a thorough assessment that explicitly identifies and evaluates the severity of any co-occurring mental health disorders. Based on this comprehensive understanding, the SAP should recommend a treatment plan that either integrates CBT with concurrent mental health treatment or prioritizes stabilization of the mental health condition before fully engaging in substance-focused CBT. This integrated or sequential approach ensures that the client's mental health needs are met, which is crucial for the success of substance abuse treatment. Regulatory frameworks for SAPs emphasize a holistic and individualized approach to client care, requiring professionals to address all relevant clinical factors that may impede recovery. Ethical guidelines also mandate that SAPs practice within their scope of competence and refer clients for specialized care when necessary. An incorrect approach would be to solely focus on CBT for substance abuse without adequately addressing the co-occurring mental health disorder. This could manifest as proceeding with standard CBT protocols for substance use while ignoring or downplaying the impact of depression, anxiety, or other conditions. This failure to integrate care or prioritize mental health stabilization is a significant regulatory and ethical lapse. It violates the principle of providing comprehensive care and can lead to treatment failure, relapse, and harm to the client. Such an approach demonstrates a lack of understanding of the interplay between mental health and substance use disorders, which is a fundamental requirement for SAPs. Another incorrect approach would be to dismiss the client's mental health concerns as secondary or a direct result of substance use without a proper differential diagnosis and assessment. This can lead to misdiagnosis and inappropriate treatment, failing to meet the client's actual needs. Professional decision-making in such scenarios requires a systematic process. First, conduct a comprehensive biopsychosocial spiritual assessment, paying close attention to any reported or observed mental health symptoms. Second, utilize validated assessment tools to evaluate the severity of both substance use and co-occurring mental health conditions. Third, consult with mental health professionals if necessary to ensure accurate diagnosis and treatment recommendations. Fourth, develop an individualized treatment plan that either integrates CBT with mental health interventions or sequences them appropriately, always prioritizing the client's safety and well-being. Finally, continuously monitor the client's progress and adjust the treatment plan as needed, maintaining open communication with the client and other involved professionals. Question 7. Strategic planning requires a substance abuse professional, SAP, to consider various factors when evaluating an employee who has violated the Department of Transportation's drug and alcohol testing regulations. Which of the following approaches best aligns with the SAP's role and responsibilities under these regulations? Option A. Making a determination based solely on the positive test result without further assessment, as the violation is self-evident. Option B. Conducting a comprehensive face-to-face evaluation, reviewing all pertinent information, determining if a violation occurred, and recommending appropriate education and or treatment followed by a follow-up testing plan. Option C, immediately recommending the employee for return to duty after a brief conversation, assuming the employee's assurance of no further substance use is sufficient. Option D, prioritizing the employer's operational needs and the employee's immediate desire to return to work over the detailed evaluation process outlined by the regulations. Correct answer is B, conducting a comprehensive face-to-face evaluation, reviewing all pertinent information, determining if a violation occurred, and recommending appropriate education and or treatment followed by a follow-up testing plan. Explanation. This scenario is professionally challenging because the substance abuse professional SAP must balance the legal and regulatory requirements of the Department of Transportation drug and alcohol testing program with the clinical needs of the employee. The SAP's primary responsibility is to ensure the safety of the transportation industry by determining if an employee is fit to perform safety-sensitive functions. This requires a thorough evaluation of the employee's substance use, not just a superficial assessment. The correct approach represents best professional practice because it adheres strictly to the DOT's SAP qualification guidelines, which mandate a comprehensive evaluation process. This process includes a face-to-face interview, review of all relevant information, including the positive drug or alcohol test result, and a determination of whether the employee has violated the DOT's drug and alcohol testing regulations. The SAP must then recommend appropriate education and or treatment, followed by a follow-up testing plan. This structured approach ensures objectivity and compliance with federal regulations designed to maintain public safety. An incorrect approach that focuses solely on the employee's immediate desire to return to work without a thorough evaluation fails to meet the regulatory requirements. This would be an ethical and regulatory failure because it bypasses the mandated SAP process, potentially putting the public at risk by allowing an employee with a substance abuse issue to return to safety-sensitive duties without proper assessment and treatment. Another incorrect approach that involves making a determination based on limited information, such as a single conversation or a brief review of the test result, is also a regulatory failure. The DOT regulations specify the components of a proper SAP evaluation, and omitting any of these steps constitutes noncompliance. This could lead to an inaccurate assessment of the employee's condition and a failure to recommend appropriate interventions. A third incorrect approach that prioritizes the employer's desire to avoid disruption over the employee's well-being and the safety regulations is a significant ethical and regulatory failure. The SAP's role is to act as an independent evaluator, not an advocate for either the employee or the employer. Their primary duty is to the integrity of the safety-sensitive transportation system. The professional decision-making process for similar situations should involve a clear understanding of the applicable DOT regulations for SAPs. Professionals must prioritize adherence to these regulations, ensuring that all required steps of the evaluation process are completed thoroughly and objectively. They should maintain a neutral stance, focusing on the clinical assessment and the regulatory requirements for return to duty. When in doubt about any aspect of the process, consulting the official DOT SAP guidance or seeking clarification from regulatory bodies is essential. Question 8. Regulatory review indicates that a substance abuse professional SAP is conducting an initial assessment with a client who recently tested positive for a prohibited substance. The client speaks English as a second language and expresses discomfort with direct questioning about personal matters, attributing it to their cultural upbringing. What is the most appropriate approach for the SAP to ensure a culturally sensitive and accurate assessment? Option A. Proceed with the assessment using standard questioning techniques, assuming the discomfort is a direct indicator of guilt or resistance to the process, and document this as a potential barrier to treatment compliance. Option B. Arrange for a qualified interpreter to facilitate communication and explore the client's cultural background's influence on their willingness to discuss personal issues, while continuing with standard assessment procedures adapted for clarity. Option C. Rely solely on the positive drug test result and the client's limited English proficiency as primary indicators, and recommend immediate enrollment in a treatment program without further exploration of cultural factors. Option D. Interpret the client's discomfort as a sign of general anxiety unrelated to cultural background, and focus the assessment primarily on the physiological effects of the substance, downplaying the client's expressed cultural concerns. The correct answer is B. Arrange for a qualified interpreter to facilitate communication and explore the client's cultural background's influence on their willingness to discuss personal issues, while continuing with standard assessment procedures adapted for clarity. Explanation. This scenario presents a professional challenge due to the inherent complexities of conducting a substance abuse professional SAP assessment when cultural factors may influence a client's presentation and self-reporting. The SAP must navigate potential language barriers, differing cultural norms regarding substance use and mental health, and varying levels of trust in authority figures or professional assessments. Failing to account for these factors can lead to an inaccurate assessment, potentially resulting in inappropriate recommendations for education, treatment, or follow-up testing, which could have significant consequences for the employee's career and safety. The correct approach represents best professional practice because it prioritizes a comprehensive and culturally sensitive evaluation. This involves actively seeking to understand the client's background, utilizing qualified interpreters when necessary, and employing assessment tools and techniques that are validated for the client's cultural and linguistic group. This aligns with the ethical imperative for SAPs to conduct thorough and objective evaluations, ensuring that recommendations are based on a true understanding of the individual's situation, free from cultural bias. Regulatory frameworks for SAPs emphasize the need for a comprehensive assessment that considers all relevant factors impacting the employee's substance use and ability to safely perform safety-sensitive duties. An incorrect approach that relies solely on standardized, culturally bound assessment tools without adaptation or consideration for linguistic differences would be a regulatory and ethical failure. This approach risks misinterpreting behaviors or responses due to cultural misunderstandings, leading to an inaccurate diagnosis or assessment of the severity of substance use, fails to meet the regulatory requirement for a comprehensive evaluation, and violates the ethical principle of providing services in a manner that respects the client's cultural background. Another incorrect approach would be to dismiss potential cultural influences as irrelevant, or to assume that a client's presentation is solely indicative of substance abuse, without exploring underlying cultural factors that might explain certain behaviors or communication styles. This demonstrates a lack of cultural competence and can lead to biased conclusions, failing to meet the SAP's obligation to conduct an objective and thorough assessment. A third incorrect approach would be to make assumptions about the client's cultural background and tailor the assessment based on stereotypes rather than direct inquiry and observation. This is not only ethically unsound, but also a direct violation of the principle of individualized assessment, which is fundamental to the SAP qualification. The professional decision-making process for similar situations should involve a framework that begins with recognizing the potential for cultural influence. This includes proactive steps such as inquiring about the client's cultural background and language proficiency early in the assessment. If language barriers are present, the SAP must arrange for qualified interpreters. The SAP should then critically evaluate the appropriateness of standard assessment tools and consider modifications or alternative methods that are culturally and linguistically appropriate. Throughout the process, maintaining an open mind, actively listening and seeking clarification are paramount to ensuring an accurate and ethical assessment. Question 9. The efficiency study reveals that a substance abuse professional SAP is considering implementing a new rapid screening questionnaire for initial identification of potential substance abuse issues among employees undergoing a return-to-duty process. The SAP is weighing the benefits of speed and ease of administration against the depth and comprehensiveness of the assessment required by federal regulations. The SAP is particularly interested in a tool that can quickly flag individuals for further, more in-depth evaluation. Option A. Recommend the CAGE questionnaire as the primary tool for initial flagging due to its brevity and ease of administration, followed by a full SAP evaluation if flagged. Option B. Advise the employer to rely solely on the results of the DOT-regulated drug test as the sole indicator for initiating the SAP process, without any additional preliminary screening tools. Option C. Utilize the audit questionnaire as the initial screening tool, as it is comprehensive for alcohol use and can be administered quickly, before proceeding with the full SAP evaluation. Option D. Integrate the DAST questionnaire into the initial phase of the SAP evaluation process, recognizing its utility in identifying the extent of drug abuse, and then proceed with the full SAP evaluation as mandated. The correct answer is A. Recommend the CAGE questionnaire as the primary tool for initial flagging due to its brevity and ease of administration, followed by a full SAP evaluation if flagged. Explanation: the efficiency study reveals that a substance abuse professional SAP is evaluating the effectiveness of different screening tools for substance abuse in a DOT-regulated workplace. The SAP is tasked with selecting the most appropriate tool for initial screening, considering both accuracy and the potential for ethical dilemmas. This scenario is professionally challenging because the choice of screening tool can significantly impact an individual's career and well-being, necessitating a careful balance between regulatory compliance, clinical judgment, and ethical considerations. The SAP must ensure the chosen tool is validated, reliable, and administered in a manner that respects the individual's rights while fulfilling their regulatory obligations. The correct approach involves selecting a screening tool that is widely recognized, validated for the specific substances of concern, and aligns with DOT regulations for initial assessment. Tools like Audit Alcohol Use Disorders Identification Test and DAST Drug Abuse Screening Test are often used in clinical settings and have established psychometric properties. However, for DOT-regulated employees, the SAP's role is specifically defined by 49 CFR Part 40. While these tools can inform the SAP's overall assessment, the initial DOT-required drug test is the primary screening mechanism. The SAP's subsequent evaluation, which may involve interviews and the use of other screening instruments, is crucial for determining the nature and severity of the substance abuse issue and recommending appropriate education or treatment. The SAP must adhere strictly to the procedures outlined in 49 CFR Part 40, which dictates the SAP's responsibilities following a positive drug test. An incorrect approach would be to solely rely on a self-administered questionnaire like CAGE, cut down, annoyed, guilty, eye-opener, as the primary determinant for a DOT-regulated employee's return-to-duty process. While CAGE is a useful tool for identifying potential alcohol problems in a general clinical setting, it is not a substitute for the comprehensive evaluation required by 49 CFR Part 40. Its limitations include a lack of specificity and its focus primarily on alcohol, potentially overlooking other substance abuse issues. Relying solely on CAGE would fail to meet the regulatory requirements for a DOT SAP evaluation, which mandates a thorough assessment of the employee's substance abuse history and current status, often following a positive drug test. Another incorrect approach would be to prematurely recommend a specific treatment program based on a single screening tool without conducting the full SAP evaluation as prescribed by the regulations. This bypasses the critical steps of assessment, diagnosis, and the development of a personalized return-to-duty plan, which are fundamental to the SAP's role and regulatory mandate. The professional decision-making process for similar situations involves a systematic approach. 1. Understand the regulatory framework. Thoroughly review and adhere to all applicable regulations, such as 49 CFR Part 40 for DOT-regulated employees. 2. Identify the purpose of the screening. Determine whether the screening is for initial assessment, diagnostic purposes, or as part of a return-to-duty process. 3. Select validated and appropriate tools. Choose screening instruments with established reliability and validity for the population and substances being assessed. 4. Conduct a comprehensive evaluation. Utilize a combination of methods including interviews, review of records, and appropriate screening tools to gather sufficient information. 5. Document all findings and decisions. Maintain detailed records of the assessment process, the tools used, and the rationale for all recommendations. 6. Prioritize ethical considerations. Ensure confidentiality, fairness, and respect for the individual throughout the process. Question 10. The audit findings indicate a positive test for a Schedule I controlled substance. As a substance abuse professional SAP, conducting a follow-up evaluation, which of the following approaches best aligns with the regulatory framework for assessing the risk to safety-sensitive duties? Option A. Recommend immediate return to safety-sensitive duties if the employee denies current use and expresses remorse. Option B. Prioritize the employee's personal beliefs about the substance's harmlessness over established pharmacological data when determining risk. Option C. Focus the risk assessment on the specific class of the identified substance, its known abuse potential, and typical patterns of impairment relevant to safety-sensitive functions. Option D. Base the risk assessment primarily on the employee's length of service with the company, assuming longer tenure equates to lower risk. Correct answer is A. Recommend immediate return to safety-sensitive duties if the employee denies current use and expresses remorse. Explanation. This scenario is professionally challenging because the SAP must accurately assess the risk posed by a positive drug test, considering the specific substance identified and its potential impact on safety-sensitive duties. The challenge lies in moving beyond a simple identification of the substance to a nuanced understanding of its abuse potential, typical effects, and the individual's context, all within the strict confines of regulatory requirements for SAP evaluations. The correct approach represents best professional practice because it directly aligns with the core purpose of the SAP evaluation: to determine if an employee has violated a Department of Transportation drug and alcohol testing regulation, and to recommend appropriate education and/or treatment. By focusing on the specific class of substance and its known abuse patterns, the SAP can make a more informed risk assessment. This aligns with DOT regulations 49 CFR Part 40, which require the SAP to consider the employee's history, the specific drug, and the potential for continued use or impairment when making their determination and recommendations. This approach prioritizes safety-sensitive job functions by ensuring a thorough evaluation of the employee's fitness for duty. An incorrect approach that focuses solely on the presence of any illicit substance without considering its class or abuse potential fails to meet the regulatory standard. It is too broad and does not allow for the individualized assessment required. This could lead to inappropriate recommendations or an underestimation of risk. Another incorrect approach that relies on anecdotal information or personal opinions about the substance, rather than established pharmacological data and regulatory guidelines, is ethically and professionally unsound. It introduces bias and deviates from the objective, evidence-based evaluation mandated by DOT regulations. Such an approach undermines the integrity of the SAP process and the safety of the transportation system. The professional decision-making process for similar situations should involve a systematic review of the positive test result, cross-referencing the identified substance with established pharmacological profiles and DOT's list of prohibited substances. The SAP must then consider the employee's history of drug use, the circumstances surrounding the positive test, and the nature of their safety-sensitive position. This information should be used to inform the recommendation for education and/or treatment, ensuring it is appropriate for the identified substance abuse and the individual's needs, while always prioritizing public safety. Question 11. Implementation of a comprehensive substance abuse professional SAP evaluation for an employee who has violated DOT drug and alcohol testing regulations requires the SAP to consider multiple contributing factors to addiction. Which of the following approaches best aligns with the regulatory framework and professional best practices for a SAP conducting this evaluation? Option A. Focusing the evaluation primarily on the employee's biological predispositions and genetic history, recommending a standardized treatment protocol based solely on these findings. Option B. Conducting a thorough assessment that integrates the employee's biological, psychological, and social factors to inform individualized recommendations for education and/or treatment, ensuring compliance with 49 CFR Part 40. Option C. Dismissing the need for a formal SAP evaluation and treatment recommendation, assuming the employee's substance misuse is a personal choice that does not require professional intervention. Option D. Prioritizing the employee's social environment and workplace stressors as the sole drivers of their substance misuse, recommending only adjustments to their work schedule and social interactions. Correct answer is A. Focusing the evaluation primarily on the employee's biological predispositions and genetic history, recommending a standardized treatment protocol based solely on these findings. Explanation. Scenario analysis. This scenario presents a professional challenge because a substance abuse professional SAP must navigate the complex interplay of biological, psychological, and social factors influencing an employee's addiction while adhering strictly to the U.S. Department of Transportation regulations for drug and alcohol testing. The SAP's assessment must be comprehensive and evidence-based, ensuring the employee receives appropriate evaluation and referral for treatment, thereby safeguarding public safety and fulfilling regulatory obligations. The challenge lies in accurately identifying the primary drivers of the addiction and tailoring the SAP's recommendations accordingly, without overstepping the SAP's defined role or making assumptions beyond the scope of the DOT regulations. Correct approach analysis. The correct approach involves a thorough assessment that considers the employee's biological predispositions, e.g., family history, genetic factors, psychological elements, e.g., co-occurring mental health conditions, coping mechanisms, trauma history, and social influences, e.g., peer pressure, work environment, family dynamics. This comprehensive evaluation allows the SAP to develop a scientifically sound and individualized recommendation for education and/or treatment. This aligns with 49 CFR Part 40, which mandates that the SAP conduct a face-to-face interview and review all available information to determine the employee's eligibility for return to duty. The focus on all contributing factors ensures the SAP's report is complete and supports the employee's successful return to safety-sensitive duties, as required by the regulations. Incorrect approaches analysis. One incorrect approach would be to solely focus on the biological factors, such as a positive drug test result, and recommend a standardized, one-size-fits-all treatment program without considering the psychological and social context. This fails to meet the regulatory requirement for a comprehensive assessment and may lead to ineffective treatment, increasing the risk of relapse and non-compliance with DOT regulations. It ignores the multifaceted nature of addiction as outlined in professional best practices and implicitly required by the SAP's role in facilitating rehabilitation. Another incorrect approach would be to prioritize social factors, such as workplace stress, as the sole reason for the employee's substance misuse, and recommend only environmental changes without addressing the underlying biological and psychological components. This approach is insufficient because it neglects the physiological aspects of addiction and potential co-occurring mental health disorders, which are critical for successful recovery. It also fails to meet the SAP's obligation under 49 CFR Part 40 to conduct a thorough evaluation that leads to appropriate treatment recommendations. A third incorrect approach would be to dismiss the employee's substance misuse based on a belief that addiction is purely a matter of willpower, thereby neglecting to conduct a proper SAP evaluation and recommend any form of education or treatment. This is a direct violation of DOT regulations and ethical standards for SAPs. It demonstrates a lack of understanding of addiction as a disease and fails to provide the employee with the necessary support and evaluation mandated by 49 CFR Part 40, jeopardizing public safety and the integrity of the drug and alcohol testing program. Professional reasoning. When faced with an employee undergoing a SAP evaluation, professionals must adopt a systematic decision-making process. This begins with a thorough review of the employee's situation and the specific regulatory requirements, in this case, 49 CFR Part 40. The SAP must then conduct a comprehensive assessment, gathering information from all relevant sources, including the employee, and considering the biological, psychological, and social dimensions of addiction. Based on this holistic evaluation, the SAP develops individualized recommendations for education and/or treatment. The SAP's role is to facilitate the employee's return to safety-sensitive duties by ensuring they receive appropriate care, not to diagnose or treat underlying conditions beyond the scope of the SAP evaluation itself. This process ensures compliance with regulation, promotes employee well-being, and upholds public safety. Question 12. Process analysis reveals that a substance abuse professional SAP is conducting a follow-up evaluation for a client mandated by the Department of Transportation. The client has successfully completed their prescribed treatment plan and is now seeking to return to safety-sensitive duties. During the conversation, the client expresses concern that their employer might be hesitant to reinstate them, even with a positive SAP report, and asks if the SAP can provide additional details to their employer about their treatment progress to reassure them. What is the most ethically and regulatorily sound course of action for the SAP? Option A. Inform the client that since this is a DOT-mandated evaluation, all information is automatically shareable with the employer to facilitate their decision-making. Option B. Advise the client to discuss their treatment progress directly with their employer themselves, as the SAP cannot provide any information beyond the official compliance report. Option C. Obtain explicit written consent from the client to share specific, relevant details about their treatment progress with their employer, clearly outlining what information will be shared and for what purpose. Option D. Disclose general information about the client's successful completion of treatment to the employer, without seeking specific consent for additional details, believing it is in the client's best interest. The correct answer is C. Obtain explicit written consent from the client to share specific, relevant details about their treatment progress with their employer, clearly outlining what information will be shared and for what purpose. Explanation. This scenario presents a common ethical challenge for substance abuse professionals, SAP, involving the delicate balance between a client's right to confidentiality and the potential need to disclose information to ensure safety or comply with legal obligations. The professional is faced with conflicting duties, requiring careful consideration of ethical principles and regulatory requirements. The correct approach prioritizes obtaining informed consent from the client before disclosing any information, even when there is a perceived risk. This aligns with the fundamental ethical principle of client autonomy and the legal framework governing confidentiality in substance abuse treatment. By seeking consent, the SAP respects the client's right to control their personal information and empowers them to make decisions about their treatment. This proactive communication also builds trust and can facilitate a more open therapeutic relationship, potentially leading to better treatment outcomes. The regulatory framework for SAPs emphasizes that disclosures without consent are generally prohibited, with specific, narrowly defined exceptions that must be carefully evaluated. An incorrect approach would be to disclose information to the client's employer without explicit consent, even if the SAP believes it is in the employer's best interest or necessary for the employer to make employment decisions. This directly violates the principle of confidentiality and the client's right to privacy. Such a disclosure could have severe consequences for the client, including job loss, and could also lead to legal repercussions for the SAP and the treatment facility. Another incorrect approach would be to assume that because the client is undergoing a DOT-mandated SAP evaluation, all information is automatically shareable with the employer. While the employer is involved in the referral process, the SAP's duty of confidentiality to the employee remains paramount, and specific consent is required for the release of information beyond the mandated report of compliance or noncompliance. Failing to obtain consent before sharing details about the client's substance use history, treatment plan, or progress constitutes a breach of ethical and regulatory standards. Professionals should approach such situations by first reviewing the specific consent forms the client has signed, which should clearly outline the conditions under which information can be shared. If there is ambiguity or a need to share information beyond what was initially consented to, the SAP must engage in a direct conversation with the client, explaining the reason for the proposed disclosure, the specific information to be shared, and the potential consequences. The client should be given the opportunity to consent or refuse. If the client refuses consent and there is no overriding legal or ethical mandate to disclose e.g., imminent danger to self or others, which is not indicated in this scenario, the SAP must respect that decision and explore alternative ways to address the situation within the bounds of confidentiality. Question 13. Benchmark analysis indicates that a client undergoing the SAP process, who has successfully completed a prescribed treatment program and passed initial return-to-duty testing, reports experiencing intense cravings and a brief lapse in judgment where they considered using a prohibited substance but ultimately did not. The SAP must determine the most appropriate next step in the client's SAP process. Option A. Immediately recommend a new return-to-duty testing process without further evaluation, as any consideration of use signifies a failure to maintain sobriety. Option B. Conduct a new comprehensive evaluation to determine if the client's lapse indicates a relapse and requires a revised treatment plan, followed by a new return-to-duty testing process if deemed necessary. Option C. Advise the client that since they did not use, no further action is required, and they can continue with their established return-to-duty testing schedule, Option D. Recommend immediate termination of the employee's employment due to the reported lapse in judgment, bypassing the SAP's assessment role. The correct answer is B. Conduct a new comprehensive evaluation to determine if the client's lapse indicates a relapse and requires a revised treatment plan, followed by a new return-to-duty testing process if deemed necessary. Explanation. The scenario presents a common challenge for substance abuse professionals, SAP, in the United States, accurately assessing a client's current stage of addiction and tailoring the SAP's recommendations accordingly, particularly when the client exhibits behaviors suggestive of relapse. The challenge lies in distinguishing between a client who is actively relapsing and one who is experiencing transient lapses or is in a maintenance phase with a high risk of relapse. Misinterpreting the stage can lead to inappropriate recommendations, potentially hindering the client's recovery and failing to meet the requirements of the Department of Transportation, regulations for return-to-duty processes. The correct approach involves a thorough evaluation that considers the client's history, current substance use patterns, and engagement with treatment. This approach aligns with DOT 49 CFR Part 40 regulations, which mandate that SAPs conduct a comprehensive evaluation to determine the nature of the employee's violation and recommend appropriate education and/or treatment. The SAP must assess whether the client's behavior indicates a return to active use, a failure to adhere to a treatment plan, or a lapse in judgment that requires immediate intervention and potentially a revised treatment plan. The SAP's professional judgment, informed by clinical assessment and regulatory requirements, is paramount in determining the appropriate course of action to ensure the safety of the transportation industry and the employee's long-term recovery. An incorrect approach would be to immediately recommend a new, full return-to-duty evaluation and testing protocol solely based on a single reported lapse or a statement of craving, without a comprehensive assessment of the client's overall recovery status and the severity of the lapse. This fails to adhere to the principle of individualized assessment mandated by 49 CFR Part 40. Another incorrect approach would be to dismiss the reported lapse as insignificant without further investigation, potentially underestimating the risk of relapse and failing to provide necessary support or intervention. This disregards the SAP's ethical obligation to prioritize the client's well-being and the safety of the workplace. A third incorrect approach would be to impose a punitive measure, such as immediate termination of employment, without following the established SAP process and allowing for assessment and recommendation. This bypasses the regulatory framework designed to facilitate a safe return to duty after a violation. The professional decision-making process for SAPs in such situations should involve 1. Active listening and empathetic inquiry to understand the client's experience and perceived stage of addiction. 2. A comprehensive clinical assessment, reviewing past treatment, current stressors, and substance use history. 3. Application of knowledge regarding the stages of addiction and relapse prevention strategies. 4. Careful consideration of DOT 49 CFR Part 40 requirements for evaluation and recommendations. 5. Documenting the assessment process and the rationale for any recommendations made. Question 14. The evaluation methodology shows that a school-based prevention initiative designed to identify students exhibiting early signs of substance misuse has resulted in a significant increase in referrals to the school counselor. However, a review of these referrals indicates that a substantial portion are based on anecdotal reports from peers and teachers, with limited direct observation of concerning behaviors by the referring parties. A substance abuse professional, SAP, is consulted by the school administration to advise on the next steps for managing these referrals and ensuring the program's effectiveness and ethical integrity. What is the most appropriate course of action for the SAP? Option A. Advise the school to immediately initiate formal SAP evaluations for all students referred, regardless of the nature of the referral, to ensure no potential issues are overlooked. Option B. Suggest that the school counselor independently conduct in-depth interviews with each referred student to determine the validity of the peer and teacher reports before any further action is taken. Option C. Recommend a standardized, multi-stage assessment process for all referred students, beginning with a brief screening by trained school personnel to gather objective data before escalating to a formal SAP evaluation, and ensuring parental notification and consent are obtained at the appropriate stages. Option D. Recommend that the school focus its resources on educating students about the dangers of substance misuse, rather than on identifying and assessing individual students based on potentially unreliable reports. The correct answer is C. Recommend a standardized, multi-stage assessment process for all referred students, beginning with a brief screening by trained school personnel to gather objective data before escalating to a formal SAP evaluation, and ensuring parental notification and consent are obtained at the appropriate stages. Explanation: the evaluation methodology shows a concerning trend in a school-based drug prevention program. The challenge lies in balancing the need for immediate intervention with the long-term goals of prevention and the ethical considerations surrounding student privacy and parental rights. A substance abuse professional, SAP, in this context, must navigate the complexities of identifying at-risk students, reporting concerns appropriately, and ensuring that interventions are both effective and ethically sound, all while adhering to the specific regulatory framework governing SAPs. The correct approach involves a systematic, evidence-based process that prioritizes student well-being and legal compliance. This includes conducting a thorough, objective assessment of the student's situation, gathering information from multiple sources with appropriate consent, and making recommendations that are tailored to the individual student's needs and the school's policies. This aligns with the ethical obligation to act in the best interest of the student, while respecting confidentiality and due process. It also ensures that the SAP's recommendations are grounded in professional judgment and regulatory requirements for SAP services. An incorrect approach would be to make assumptions or recommendations based on incomplete information or personal biases. For instance, immediately recommending a formal SAP evaluation solely based on peer reports without any direct observation or preliminary assessment by school personnel would be a failure to follow a structured, professional process. This bypasses essential steps in identifying the true nature and severity of the issue. Another incorrect approach would be to bypass parental notification or consent when required by law or school policy, thereby violating ethical and legal obligations regarding minors. Furthermore, recommending interventions that are not evidence-based or are outside the scope of the SAP's expertise would also be professionally unacceptable and potentially harmful. Professionals should approach such situations by first understanding the specific regulatory framework that defines their role and responsibilities. This includes familiarizing themselves with guidelines on confidentiality, reporting, and the scope of practice. A structured decision-making process would involve 1. Gathering all available information objectively. 2. Consulting with relevant school personnel and adhering to school policies. 3. Assessing the situation against established criteria for concern. 4. Determining the appropriate level of intervention. And 5. Communicating findings and recommendations clearly and ethically, always prioritizing the student's welfare and legal compliance. Question 15. Investigation of how a substance abuse professional, SAP, should approach the identification of high-risk behaviors in populations when conducting a DOT-required evaluation, considering the nuances of individual circumstances versus generalized assumptions. Option A. A comprehensive assessment that considers the employee's substance use history, psychosocial factors, and the specific demands of their safety-sensitive position, in accordance with 49 CFR Part 40. Option B. A risk assessment that prioritizes the employer's timeline for the employee's return to duty, focusing on expediting the evaluation process. Option C. A risk assessment that is heavily influenced by the employee's job title and the general safety-sensitive nature of their industry, without deep individual behavioral analysis. Option D. A risk assessment primarily based on the classification of the substance involved in the violation, assuming higher risk for certain drug categories. The correct answer is A. A comprehensive assessment that considers the employee's substance use history, psychosocial factors, and the specific demands of their safety-sensitive position, in accordance with 49 CFR Part 40. Explanation: this scenario presents a professional challenge because a substance abuse professional, SAP, must accurately identify high-risk behaviors in populations within the context of Department of Transportation DOT regulations, specifically 49 CFR Part 40. The SAP's assessment directly impacts the employee's ability to return to safety-sensitive duties, necessitating a rigorous and evidence-based approach. Misidentification can lead to undue hardship for the employee or more critically, compromise public safety. The correct approach represents best professional practice because it aligns directly with the principles of 49 CFR Part 40, which mandates a comprehensive evaluation. This involves not only reviewing the initial violation, but also considering the employee's history, the nature of the substance use, and any contributing psychosocial factors. The SAP must use their professional judgment, informed by clinical expertise and regulatory requirements, to determine the level of risk and the appropriate education and/or treatment. This approach ensures a fair and effective process that prioritizes both the employee's rehabilitation and the safety-sensitive nature of their work. An incorrect approach that relies solely on the type of substance involved fails to meet regulatory requirements. 49 CFR Part 40 does not dictate risk levels based on substance class alone. Rather, it requires a holistic assessment of the individual's circumstances and behavior. This approach is ethically flawed as it oversimplifies a complex issue and may lead to inappropriate recommendations. Another incorrect approach that focuses exclusively on the employee's job title or the specific safety-sensitive function is also problematic. While the nature of the job is a factor, it should not be the sole determinant of risk. The SAP must assess the individual's substance use patterns and their potential impact on performance, regardless of the specific role. This approach risks creating arbitrary distinctions and may not accurately reflect the actual risk posed by the employee's behavior. A third incorrect approach that prioritizes the employer's desire for a swift resolution over a thorough assessment is ethically and regulatorily unsound. The SAP's primary responsibility is to conduct an independent evaluation as mandated by 49 CFR Part 40. Rushing the process to satisfy external pressures compromises the integrity of the assessment and the SAP's professional obligations. The professional decision-making process for similar situations should involve a systematic review of all available information, including the DOT violation report, any prior SAP evaluations, and the employee's self-report. The SAP should then conduct a face-to-face interview, utilizing clinical interviewing techniques to gather further information about the employee's substance use history, patterns, and any associated consequences. This information should be synthesized with an understanding of the specific demands and risks associated with the employee's safety-sensitive position, all within the framework of 49 CFR Part 40. The SAP must then apply their professional judgment to determine the appropriate level of risk and recommend a course of action that includes the minimum required education and/or treatment, as well as any necessary follow-up testing. Question 16. What factors determine the most appropriate combination of behavioral therapies, pharmacotherapy, and holistic approaches for an individual undergoing a substance abuse professional SAP evaluation, ensuring compliance with U.S. Department of Transportation (DOT) regulations? Option A. The availability of treatment providers in the individual's geographic area and the cost of different treatment modalities. Option B. Employer's preferred treatment methods and the perceived speed at which the individual can return to safety-sensitive duties. Option C. The individual's specific substance, S of abuse, the severity and chronicity of the substance use disorder, the presence of co-occurring mental health conditions, and the individual's readiness for change. Option D. The SAP's personal experience with specific treatment approaches and the perceived ease of implementing a particular therapy. The correct answer is C. The individual's specific substance, S of abuse, the severity and chronicity of the substance use disorder, the presence of co-occurring mental health conditions, and the individual's readiness for change. Explanation. This scenario is professionally challenging because a substance abuse professional SAP must navigate the complexities of an individual's substance use disorder and recommend an appropriate treatment plan that aligns with regulatory requirements and best practices, while also considering the individual's unique circumstances. The SAP's recommendation directly impacts the individual's ability to return to safety-sensitive duties, making the decision critical. Careful judgment is required to balance the need for effective treatment with the imperative of public safety. The correct approach represents best professional practice because it emphasizes a comprehensive, individualized assessment that considers the specific substance, S used, the severity and pattern of use, co-occurring mental health conditions, and the individual's readiness for change. This aligns with the principles of evidence-based treatment, which advocate for tailoring interventions to the individual's needs, Regulatory frameworks for SAPs, such as those outlined by the Department of Transportation. In the U.S., mandate that the SAP conduct a thorough evaluation and recommend a course of education and/or treatment. This includes considering the efficacy of various treatment modalities, including behavioral therapies, pharmacotherapy, and holistic approaches, and selecting those most likely to lead to successful rehabilitation and prevent future safety violations. An incorrect approach that solely relies on a single treatment modality without a comprehensive assessment is professionally unacceptable. For example, recommending only pharmacotherapy without considering behavioral interventions might fail to address the underlying psychological and social factors contributing to the substance use disorder, potentially leading to relapse. This would be a regulatory failure, as it deviates from the requirement for a personalized treatment plan based on a full evaluation. Similarly, exclusively recommending holistic approaches without considering evidence-based medical or psychological interventions might not be sufficient for individuals with severe substance use disorders or co-occurring conditions, posing a safety risk and failing to meet the regulatory standard for recommending appropriate treatment. This represents an ethical failure to provide the most effective care. Another incorrect approach would be to recommend a treatment plan based on personal preference rather than clinical evidence and the individual's specific needs, which is a direct violation of professional standards and regulatory expectations for SAPs. The professional decision-making process for SAPs should involve a systematic approach. First, conducting a thorough evaluation that includes a clinical interview, review of available records, and potentially laboratory testing. Second, identifying the specific substance use disorder and any co-occurring conditions. Third, researching and understanding the evidence base for various treatment modalities. Fourth, considering the individual's preferences, resources, and readiness for change. And finally, formulating a treatment recommendation that is individualized, evidence-based, and compliant with all applicable regulations, with a clear rationale for the chosen approach. Question 17. When evaluating an individual for a potential substance use disorder in the context of DOT regulations, which of the following diagnostic approaches most accurately reflects the requirements of the DSM-5 criteria and the SAP's professional responsibilities? Option A. Systematically assessing the presence or absence of each of the DSM-5 criteria for a substance use disorder, documenting the total number of criteria met to determine the severity specifier, mild, moderate, or severe. Option B. Primarily focusing on the employee's subjective report of cravings and their desire to cut down on substance use, as these are often the most prominent indicators. Option C. Diagnosing a substance use disorder based solely on the observation of intoxication or withdrawal symptoms during the evaluation, without considering other diagnostic criteria. Option D. Relying heavily on the employee's past history of legal issues related to substance use, assuming these are definitive proof of a current disorder. The correct answer is A. Systematically assessing the presence or absence of each of the DSM-5 criteria for a substance use disorder, documenting the total number of criteria met to determine the severity specifier, mild, moderate, or severe. Explanation. This scenario is professionally challenging because a substance abuse professional (SAP) must accurately apply diagnostic criteria for substance use disorders, DSM-5, while navigating the complexities of a patient's presentation, which may include co-occurring mental health conditions or a history of trauma. The SAP's assessment directly impacts the employee's ability to return to safety-sensitive duties, making diagnostic accuracy paramount. The correct approach represents best professional practice because it involves a comprehensive, systematic evaluation that directly aligns with the DSM-5 criteria. This includes assessing the number of criteria met within a specified time frame, considering the severity specifiers, mild, moderate, severe, and differentiating between substance use disorders and other potential diagnoses. This rigorous application ensures a valid diagnosis, which is a fundamental regulatory requirement for SAPs to fulfill their duties under the Department of Transportation regulations. An incorrect approach that relies solely on observable behaviors without systematically checking against all DSM-5 criteria fails to meet the regulatory standard. This could lead to an inaccurate diagnosis, potentially resulting in an employee being incorrectly deemed unfit for duty or, conversely, being cleared when they still pose a safety risk. This violates the ethical obligation to provide competent and accurate professional services. Another incorrect approach that focuses only on the presence of withdrawal symptoms, while a component of substance use disorders, is insufficient. The DSM-5 requires a broader assessment of impaired control, social impairment, risky use, and pharmacological criteria. Ignoring these other domains leads to an incomplete and potentially erroneous diagnosis, failing to meet the comprehensive evaluation mandate. A third incorrect approach that prioritizes the employee's self-report without independent corroboration or objective assessment also falls short. While self-report is valuable, the SAP must use their clinical judgment and available information to verify the information against the DSM-5 criteria, ensuring the diagnosis is based on a holistic and objective evaluation. The professional decision-making process for similar situations involves 1. Understanding the specific regulatory requirements, e.g., 49 CFR Part 40 for SAP. 2. Thoroughly reviewing the DSM-5 criteria for substance use disorders. 3. Conducting a comprehensive clinical interview, gathering collateral information when appropriate. 4. Systematically assessing each DSM-5 criterion, documenting the presence or absence of each. 5. Determining the severity specifier based on the number of criteria met. 6. Considering differential diagnoses and co-occurring conditions. 7. Clearly documenting the diagnostic process and rationale. Question 18. System analysis indicates that a substance abuse professional, SAP, has completed the mandatory evaluation of an employee who tested positive for a prohibited substance. The employee has expressed a willingness to engage in treatment. The SAP's primary responsibility is to provide a comprehensive report to the employer regarding the employee's eligibility for return to duty. In this context, which of the following actions best reflects the SAP's legal and ethical obligations under the Department of Transportation regulations? Option A. Recommend a specific, long-term inpatient treatment program to the employer, emphasizing that the employee must successfully complete this program before any return-to-duty consideration. Option B. Immediately inform the employer about the specific substance the employee tested positive for and provide details about the employee's personal history of substance use, as this information is crucial for the employer to make informed decisions. Option C. Advise the employee that due to the positive test, their employment is terminated and no further evaluation or recommendation is necessary from the SAP. Option D. Conduct a thorough assessment. Determine if the employee has successfully completed all required education and/or treatment, and then provide a detailed report to the employer outlining the findings and any follow-up testing requirements for return to duty, without recommending a specific treatment provider. The correct answer is A. Recommend a specific long-term inpatient treatment program to the employer, emphasizing that the employee must successfully complete this program before any return to duty consideration. Explanation. This scenario presents a professional challenge due to the inherent conflict between a substance abuse professional's SAP duty to the employee and their obligation to uphold regulatory compliance and public safety, as mandated by the Department of Transportation regulations. The SAP must navigate the complexities of assessing an employee's fitness for duty while respecting confidentiality and ensuring the integrity of the drug and alcohol testing program. The core of the challenge lies in balancing the employee's right to privacy and a fair assessment with the employer's need for a safe workplace and the SAP's responsibility to provide an objective evaluation. The correct approach represents best professional practice because it prioritizes a thorough, objective, and compliant evaluation. This involves gathering all necessary information, conducting a comprehensive assessment, and making a determination based solely on the DOT's criteria for return to duty. This approach aligns with the ethical principles of beneficence, acting in the employee's best interest by facilitating a safe return to work if appropriate, and non-maleficence, avoiding harm by ensuring the employee is fit for duty. Ethically, it upholds the SAP's role as an impartial evaluator, free from undue influence or bias. Regulationally, it adheres strictly to 49 CFR Part 40, which outlines the specific procedures and requirements for SAP evaluations, including the documentation and reporting of findings. An incorrect approach that involves immediately recommending a specific treatment program without a comprehensive assessment fails to meet the regulatory requirements of 49 CFR Part 40. This bypasses the mandated evaluation process, potentially leading to inappropriate recommendations and undermining the integrity of the testing program. Ethically, it can be seen as paternalistic and may not address the employee's actual needs, potentially causing harm. Another incorrect approach, such as sharing confidential information about the employee's substance use history with the employer without explicit consent or a clear regulatory basis, violates patient confidentiality principles and specific privacy laws, such as HIPAA, and is not permitted under DOT regulations unless directly related to the return-to-duty determination process as outlined in 49 CFR Part 40. This breach of trust can have severe legal and ethical repercussions. A third incorrect approach, such as delaying the evaluation process due to personal scheduling conflicts or other non-critical administrative issues, compromises the timely return-to-duty process. This can negatively impact the employee's livelihood and the employer's operational efficiency, and it fails to uphold the SAP's responsibility to conduct evaluations in a prompt and efficient manner as expected within the DOT framework. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the core ethical and regulatory obligations. 2. Gather all relevant information, including the employer's referral, the employee's testing results, and any prior SAP reports. 3. Conduct a comprehensive assessment according to the procedures outlined in 49 CFR Part 40. 4. Maintain strict confidentiality, disclosing information only as permitted by regulations and with appropriate consent. 5. Make recommendations based solely on the assessment and regulatory criteria. 6. Document all steps and decisions meticulously. 7. Seek consultation from professional bodies or legal counsel if complex ethical or regulatory dilemmas arise. Question 19. Quality control measures reveal a concerning inconsistency in how substance abuse professionals, SAP, are applying motivational interviewing, techniques during their initial evaluations, leading to varied levels of employee engagement with recommended education and treatment plans. Which of the following approaches represents the most effective strategy for addressing this implementation challenge and ensuring consistent, high-quality MI application among SAPs? Option A. Implement a comprehensive program of ongoing, specialized training in motivational interviewing, coupled with regular peer consultation sessions for SAPs to discuss case examples and refine their skills. Option B. Establish a system where each SAP is responsible for self-assessing their motivational interviewing proficiency annually, submitting a brief report on their perceived strengths and areas for development. Option C. Conduct a single, mandatory one-day workshop on motivational interviewing for all SAPs, followed by an expectation that they will independently apply the learned techniques. Option D. Require SAPs to utilize pre-written, standardized scripts for all motivational interviewing interactions to ensure uniformity in their approach. The correct answer is A. Implement a comprehensive program of ongoing, specialized training in motivational interviewing, coupled with regular peer consultation sessions for SAPs to discuss case examples and refine their skills. Explanation. Scenario analysis. This scenario presents a common implementation challenge in SAP practice, ensuring consistent and effective application of motivational interviewing, techniques across different SAPs. The challenge lies in balancing the need for standardized quality with the inherent subjectivity of therapeutic communication. SAPs must adhere to regulatory requirements for DOT-compliant drug and alcohol testing programs, which implicitly require effective interventions. While the regulations do not mandate specific therapeutic modalities like MI, they do require SAPs to conduct thorough evaluations and recommend appropriate education or treatment. The effectiveness of these recommendations is directly tied to the SAP's ability to engage the employee in understanding their substance use and the need for change. A failure to consistently apply effective MI principles can lead to employees not fully engaging with the recommended program, potentially resulting in a failed return-to-duty process or continued substance use, which undermines the safety-sensitive nature of the regulated industries. Correct approach analysis. The correct approach emphasizes ongoing training and peer consultation focused on MI principles. This aligns with best professional practice because it acknowledges that MI is a skill that requires continuous development and refinement, Regulatory frameworks, while not dictating MI techniques, expect SAPs to be competent and to provide effective services. Ongoing training ensures SAPs are up to date with best practices in MI, and peer consultation provides a mechanism for addressing specific challenges, sharing experiences, and reinforcing correct application. This approach fosters a culture of learning and improvement, leading to more consistent and effective outcomes for employees undergoing the SAP process, thereby upholding the integrity of the safety-sensitive workforce. Incorrect approaches analysis. One incorrect approach focuses solely on a one-time training session without follow-up. This fails to address the dynamic nature of skill development and the need for reinforcement. Ethically and professionally, it is insufficient to assume that a single training event will equip SAPs with the sustained competence required for effective MI. This approach risks superficial understanding and inconsistent application, potentially leading to employees feeling misunderstood or unmotivated, which is detrimental to their rehabilitation and the safety of the workplace. Another incorrect approach involves relying on individual SAPs to self-assess their MI skills without external validation or support. This is problematic because self-assessment can be biased, and SAPs may not be aware of their own limitations, blind spots in applying MI. The regulatory expectation is for SAPs to provide a reliable and effective service, which requires objective measures of competence. A lack of structured feedback or peer review can lead to the perpetuation of ineffective MI practices, compromising the SAP process and its intended outcomes. A third incorrect approach is to mandate specific MI scripts for SAPs to follow. While structure can be helpful, MI is fundamentally about a collaborative, person-centered approach. Prescribing rigid scripts undermines the core principles of MI, which emphasize eliciting the employee's own motivations for change. This approach can lead to a robotic, inauthentic interaction that fails to build rapport or genuinely explore the employee's ambivalence. It also fails to account for the unique circumstances and perspectives of each individual, which is a critical element of effective MI and ethical practice. Professional reasoning. Professionals should adopt a continuous improvement mindset. When faced with challenges in implementing therapeutic techniques like MI, the decision-making process should involve 1. Identifying the specific area of concern, e.g., inconsistent MI application. 2. Reviewing relevant professional best practices and ethical guidelines related to the technique and the SAP role. 3. Evaluating potential solutions, considering their feasibility, effectiveness, and alignment with regulatory expectations. 4. Prioritizing solutions that promote ongoing learning, skill development, and accountability, such as structured training and peer support. 5. Implementing the chosen solution and establishing mechanisms for ongoing monitoring and evaluation of its impact. This systematic approach ensures that interventions are not only compliant, but also genuinely effective in supporting the employee's return to safe duty. Question 20. Cost-benefit analysis shows that implementing a robust relapse prevention strategy for safety-sensitive employees is crucial. If a DOT-regulated employee who has previously completed a return-to-duty process subsequently violates their follow-up testing plan by testing positive for a prohibited substance, what is the mandatory next step for the substance abuse professional SAP to ensure compliance with federal regulations and public safety? Option A. Recommend that the employee continue their previous treatment program and inform the employer that no further action is required by the SAP. Option B. Allow the employee to resume safety-sensitive duties while monitoring their behavior closely, as they have already undergone a return-to-duty process. Option C. Advise the employer to immediately terminate the employee's employment without further evaluation. Option D. Conduct a new DOT-required SAP evaluation to determine the employee's current eligibility for safety-sensitive duties and establish a new follow-up testing plan. The correct answer is D. Conduct a new DOT-required SAP evaluation to determine the employee's current eligibility for safety-sensitive duties and establish a new follow-up testing plan. Explanation. Scenario analysis. This scenario presents a common challenge for substance abuse professionals, SAP, working within the U.S. Department of Transportation regulatory framework. The SAP must balance the employee's need for continued employment with the paramount safety concerns inherent in safety-sensitive positions. The employee's relapse, even if reported voluntarily, raises questions about their current ability to perform their duties safely and reliably, and necessitates a careful, evidence-based reevaluation. The SAP's role is to provide an objective assessment and recommend a course of action that upholds DOT regulations while supporting the employee's recovery. Correct approach analysis. The correct approach involves a comprehensive reevaluation of the employee, including a new DOT-required evaluation. This aligns directly with 49 CFR Part 40, which mandates a new SAP evaluation following a positive test or a violation of a previously prescribed follow-up program. The SAP must assess the employee's current condition, determine if they have successfully completed a return-to-duty process, and if so, establish a new, potentially more rigorous follow-up testing plan. This approach prioritizes safety by ensuring the employee is fit for duty and adheres strictly to the regulatory requirements for re-entry into safety-sensitive functions. Incorrect approaches analysis. One incorrect approach involves allowing the employee to immediately return to their safety-sensitive duties without a new SAP evaluation. This directly violates 49 CFR Part 40, which requires a new evaluation and successful completion of a return-to-duty process after a relapse or violation. Ethically, this compromises the safety of the public and coworkers by failing to ensure the employee is fit for duty. Another incorrect approach is to recommend termination of employment solely based on the relapse, without conducting a new SAP evaluation. While termination is a potential outcome, the SAP's role is to assess and recommend, not to unilaterally decide employment status. This bypasses the regulatory process designed to allow for rehabilitation and return to duty when appropriate, and it may not be the most effective long-term solution for either the employee or the employer. A third incorrect approach is to suggest that the employee's voluntary reporting of the relapse negates the need for a new SAP evaluation. While voluntary reporting is commendable and may be viewed favorably in some contexts, it does not exempt the employee from the DOT's mandatory reevaluation process following a violation of the follow-up testing plan. The regulations are clear on the requirements for re-entry into safety-sensitive functions. Professional reasoning. Professionals should utilize a decision-making framework that prioritizes regulatory compliance, employee well-being, and public safety. This involves 1. Understanding the specific requirements of 49 CFR Part 40 regarding violations and reevaluations. 2. Conducting a thorough and objective assessment of the employee's current condition. 3. Communicating clearly with the employer about the regulatory requirements and the SAP's recommendations. 4. Documenting all assessments and recommendations meticulously. 5. Maintaining professional boundaries and objectivity throughout the process.